kanza, umesema mambo ya kanza. Kwa mimi najua kanza iko. Baraka, mimi sikuambia nini inaleta kanza. Mimi sijui. And what are the causes? Mimi sijui. What are the effects? Sijui.
Naisikia tu lakini sijui nini yake. Nasikia ni ugonjwa mbaya. Ya, na kuna aina nyingi nadhani za kansa.
My name is Dr. Andrew Odhiambo. I'm a consultant medical oncologist. I'm the lead clinician here at Nairobi Radiotherapy and Cancer Center, and I also teach and work at the University of Nairobi at Kenyatta National Hospital. In order to understand what cancer is, you have to first know that in our bodies we have organs in our bodies like the heart, the lungs, the liver, and each of these organs is made up of many cells that make up the organ. So those cells usually they divide in an orderly fashion, and the cells that are old they also die by themselves in an orderly fashion, and that maintains a good state of health. So when you get cancer, these cells begin to multiply disorderly, and they begin to multiply very quickly, and it would exceed the rate of death. So you find that you have an excess amount of tissue or cells accumulating in one organ, and that eventually results into cancer.
Cancer is the leading cause of death globally. Here in Kenya, it is the third leading cause of death.
Where cancer comes from is a big debate. Some cancers we can identify what is wrong, and in most cancers we really can't pinpoint one particular thing. But we know that there are some certain risk factors that can predispose you towards developing cancer. So you can't really say that cancer comes from a certain place, no, but we know individuals have some little bit of genetic risk factors or predisposition and have some environmental factors that come into play. Maybe I can give an example with, let's say, breast cancer. If you have one or two relatives with breast cancer, probably at a younger age, then in your family there's probably a gene that is malfunctioning and that can predispose you towards developing breast cancer. And so somebody belonging to that family usually is at a higher risk, and they can develop the cancer usually at a very young age. But it doesn't mean that you must develop it. So that's basically how to understand where cancer comes from. We're still studying cancer a lot and trying to understand really what is the big problem. Why do the cells just go ballistic one day and start growing?
Kwa majina naitwa Isaya Kirema. Nimetoka Meru County. Wakati nilisikia niko na ugonjwa mwezi wa 10. Tangu wakati huo, kwa sababu ya Neospagas, nikashinda na kumeza, nikaenda Saria Mission Hospital. Kuenda huko nikaambiwa niko na cancer.
Now what Mzee is going through just shows us a glimpse of what many cancer patients go through.
My name is Dr. Ann Nganga. I work at the Ministry of Health, and I currently head the National Cancer Control Program. The National Cancer Control Program is a program within the Division of Non-Communicable Diseases in the Ministry of Health. So the role of the National Cancer Control Program is to coordinate cancer control efforts within the country, and most importantly to develop policy around cancer control, because when you look at our new constitution, the role of national government is to develop policy in terms of healthcare. So the National Cancer Control Program develops policies to guide cancer control. Cancer is a significant cause of morbidity and mortality in Kenya. So currently we estimate we have about 40,000 new cases every year of cancer, and out of that about 28,000 deaths.
My name is Dr. Catherine Nyongesa. I am a cancer specialist. I work at the Texas Cancer Center. So that's a very high fraction. Yeah, like almost 80%, of the people you meet with cancer they may succumb in that same year to the cancer because of the stage.
Cancer cases are on the rise, and I would say the challenge with this is two-pronged. So you have the patient aspect and you have the health system aspect. So when you look at it from the patient perspective, we have patients with poor health-seeking behaviors. So patients do not go for screening even when they have the information that they need to go for screening. Or in other times you have symptoms of the disease and then you wait until it's too late. So that's one aspect, and also that's related also to stigma. So when you look at the health system challenges, we have inadequate capacity to diagnose, to treat cancer. And also amongst the health workers, sometimes you'll find a patient has been through the health system with an ulcer that's not healing, and the health worker does not suspect it could be cancer. So it takes a long time for the patient to actually get an actual diagnosis of cancer. So we need to improve both on the patient aspect and the health worker aspect.
Even if we are picking 40,000 new cancer cases a year, we should actually be saying we are saving majority of them. That they are surviving, they are living with the cancer because they are getting treatment, instead of losing 2/3 of them. As we diagnose, we are losing them.
With this drastic rise of cancer cases in the country, community-based organizations have come up, such as the Kenya Network of Cancer Organizations, an umbrella body for organizations that deal with cancer patients.
My name is David Makomi. I'm the chairman of the Kenya Network of Cancer Organizations, which is known as KENCO. And KENCO is the umbrella body of cancer civil society groups in Kenya, patients groups, community-based organizations, and associations that are involved in cancer. We work under the banner of United Against Cancer. So essentially, all the cancer organizations adopt a unified approach to cancer control. They do their work in various counties of this country, but when it comes to taking certain common positions on policy issues or various aspects of cancer control, then we speak with one voice when we are engaging the government, engaging the media, and engaging other players. So we come together as one. We are nearly 30 cancer organizations and still growing, and our work is also mainly centered around empowering those cancer organizations to do their work better by strengthening their organizations and equipping them with knowledge and skills to enable them pass accurate cancer information to wananchi and even to policymakers in various counties. Cancer is a growing problem, no doubt about it. It is the next big epidemic. Cancer has the capacity of bringing down the entire economy, destroying our entire socio-economic fabric, completely wiping it out because of people or of the costs involved and the numbers involved.
One such organization is the Joanna Hostel for Cancer Patients, and we had an opportunity to interview one of the hostel's manager.
Okay, my name is Esther Randa. The place that we are in today is Joanna's Hostel for Cancer Patients, based in Nairobi, Sunview Estate, Ngumo. What we do is we host patients who've come to seek treatment in hospitals within Nairobi area and do not have accommodation while they do so. Most of our patients, when they receive referrals from their various hospitals from the rural areas and they come to seek treatment, in a day you might find that most of the processes that are normally done at the hospital are not through, and they would like a place to stay, rest, eat until the following day when they can continue with their process of treatment. So Joanna's Hostel offers such for them so that they can feel encouraged, rejuvenated on their way to quick recovery. I'm talking on behalf of Harriet. Harriet is one of my clients at the hostel. She came here on 4th of this year, January, and she came when she was very weak. She had abdominal pain. She could not walk straight, and most of the time she would crawl on the floor because of the pain she had. As an organization, Harriet will not be the first chemo patient we'll be having. So we've had various chemo patients, and we've learned we've known most of the side effects they face. So before she goes for her chemotherapy, we'll ensure that she understands what the doctor will be doing, the treatment she'll be getting, that is, and we'll explain to her the possible side effects of chemo, because most of the, not all patients go through the same side effects. So with our experience with the patients that we've had undergoing chemo, she'll be able to understand and will be able to give her best care so far.
With most cancer cases being reported at the final stage, there has been a growing need for hospice services, and the Kenya Hospice and Palliative Care Association has been key in handling this rise.
I'm Dr. Asaf Kinyanjui, Director of Programs at Kenya Hospices and Palliative Care Association. In short, it's called KEPCA. KEPCA is a non-governmental organization formed mostly from members institutions, that is hospices and palliative care units, and you have about 60 members currently in different counties in Kenya. So our main work as KEPCA is mostly to advocate for recognition of palliative care services to the government, the national government, and to the county governments, and also to raise awareness to the public, so that if when they have a patient who requires a palliative care, they can be able to refer them to the appropriate center so that they can benefit. Palliative care, according to the World Health Organization, what we call the WHO, defines palliative care as care given to the patients with life-threatening illnesses. And life-threatening illnesses are illnesses like HIV, issues like cancer, patients with any form of organ failure, and it's given to both children and adults. And the main goal of providing palliative care is to look at the patient from 4 aspects. We are looking at the patient from the physical issues. Do they have pain? Do they have vomiting? Do they have any issues with maybe loss of appetite? So we look at the physical aspect of the patient. We look at the emotional aspect of the patient. When they're having these life-threatening diseases, they have a lot in terms of, they ask themselves, well, why am I having this disease? Have it as a result of my past doings and such. So am I going to die and such things? So we try to support them emotionally. We look at the patients from the spiritual aspect. Again, most of our patients have come with spiritual needs. They end up thinking, am I being punished by my maker? Is it as a result that I've not been a faithful Christian or Muslim or whatever? So we also help them to link them, we have established a good relationship with their maker. And also we look at the social aspect of the patient, the family, the community, how can they be involved in care of these patients? So we look at it from those 4 key areas. Currently we have about 60 palliative care sites, providing care to about 30,000 patients annually. These sites are mostly based, currently they're in 25 counties. So we still have 22 counties which are not yet covered. And for our 2018-2022 work plan is to see how we can also make sure we reach to the 22 counties so that they can be able to have at least 1 palliative care center.
Though it is estimated that over 40% of all cancer cases can be prevented, there is a dramatic increase in the use of risk factors such as cigarettes and alcohol, particularly in the middle-income countries.
I used to drink, I stopped over 10 years ago, so I'm living alcohol-free life. So I have a lot of time for myself. I can drink socially, maybe 2, 3 times a glass of wine in a year. Yeah, but it's not something that pushes me, because even in some social setting, I take tea, I take other stuff. So I think I don't need it. I may need a wine maybe when there's a celebrative, extremely celebrative mood.
Diet and exercise plays a crucial role in the prevention of cancer, something that is encouraged, especially if we are to curb this rising number of cancer cases.
Before I talk about prevention, because we still don't understand where a lot of cancers come from. In fact, the latest news from the research world is bad luck is accounting for up to 60% of all cancers. But optimistically, the remaining 40%, you can do something about it. It might not be foolproof, but we encourage everyone to eat healthy, try to eat a lot of natural foods that are not processed or over-stored or over-preserved or over-salted. We try to encourage people to exercise and keep their weight low and keep their BMI normal and keep their cardiac activity high so that their metabolism remains normal. Obviously, consuming large amounts of alcohol is not encouraged. Cigarette smoking is a complete no, so that should be completely... The Tobacco Act and the people who are anti-smoking really need to penetrate and talk to our youth to completely take away, because smoking accounts for a lot of cancers in the head and neck, cancers of the lung, cancers of the stomach and the rest. And taking in a lot of fruits and vegetables which have the required micronutrients that are beneficial to our bodies.
Cancer is one of the lifestyle diseases, and it's important for us to make sure that as much as we're also talking of other factors, we need to make changes or we need to make adjustments in terms of our diets. I'm saying this because people are taking a lot of processed foods that have too much chemicals, and some of these chemicals our body cannot actually be able to recognize them. And of course, when we give the body abnormal foods, then it's actually not rocket science for us to understand that our cells will also become abnormal. So we need to make sure that we address our diet, of course, among other factors. If at all the cases of cancer will actually come down. Yeah.
Food, I eat mainly githeri for my breakfast. Even now, if we go to my car, you will get a bowl of githeri that I worked on. So I go for natural food. Yes, my meat is dried. Yeah, I buy in bulk, it's dried. So I eat dried one. I take a lot of fish. Initially, I used to go for fried, but now I'm opting more for fresh. Yes. Chicken is difficult to go by. The chicken you get around in town, I don't like. So occasionally when I go to the village, I carry like 20. I work on them. Then after that, I wait until I go again. So the rest of meal, I take tea. Unfortunately, I don't like porridge. I don't like porridge, so I take more tea. Yeah.
Ya kawaida ni uzuri kwa mtu yani kupunguza ile mafuta kwa mwili. Yeah, so that pia ina kuprotect yani usiwe na yani inakuepusha na magonjwa.
My name is Samuel. Well, you see Kenya. There's one fact I always normally say a lot. If I was given a one-on-one chance with the president or with somebody who is in charge of the roads and transport, the minister, I would actually ask him just one simple question. We are busy building all these big highways, all these big dual carriage, southern bypass, northern bypass, but then we forget one essential thing. We don't leave the space for the cyclists, for the pedestrians. It's just for the motor vehicles. So if you give me a cycling path that I can cycle and no other person is supposed to come into that path, only the cyclist, and then you have a pedestrian path, definitely I would cycle every day to work. Even if I'm living 30 kilometers, I would cycle. It's health.
Early diagnosis and regular screening is also as important so as to reduce the rising cases.
I know breast cancer is just a cancer of one of the parts of the body which affects women, and that's the breast. I have been screened, but it's quite a long time, and it's quite important to screen once in a while and as often as possible so as you know your status.
It is a good thing to go for screenings, and most people, I'm sure, are not aware of how you are supposed to do a physical exam, and I think that is some education that should go out there to the public. I also feel like the screening, people are afraid of the cost that comes with it, especially doing a mammogram. So personally, I've done the physical examinations, but I've never done the mammogram, which I think is a better test for the cancer than the physical examination. So I believe it's a good thing to be able to check regularly.
First, before you understand screening, cancer is not one disease. You know, like diabetes is basically one disease. You can go and be screened for your blood sugar and it's up or down or middle and you know what to do exactly. When you have a spectrum of diseases that are over 100, then it becomes difficult to talk about screening in general. You have to specify it to a certain cancer. So screening basically means that you are looking for a disease or signs of a disease before the patient becomes symptomatic or unwell from that disease. So basically, a normal person without any symptoms, you want to find cancer in them. We can only do that for very few cancers because most of them, the economics of scale and the tests available are not good at screening. So it's easy to screen cancers that are easy to access. The cervix is easy to access, the breasts are easy to access. And those are the two most common ones that we encourage population-wide screening. There are some cancers that you cannot screen for. Cancer of the pancreas or the stomach, for example. The symptoms look like many other diseases, amoeba or ulcers. And even then, before you develop any symptom, to screen for stomach cancer, you probably need to do more than 2 or 3 tests at the same time. They would cost you probably 60,000, 70,000 shillings. So it wouldn't make sense to subject you to such complicated tests, and you might still not be able to pick up that particular cancer. So for those cancers that are not screenable, then we just encourage patients to go for their general wellness check and to be aware of any symptoms that they can't understand or symptoms that are worrisome and unrelenting, to seek medical care on time.
Yes, screening is available and it is affordable. For example, if you look like a common cancer like cancer of the cervix, which is the most common cancer amongst women, there's a very simple test for cervical cancer screening that's available in most health facilities. So like I said earlier, sometimes the patient doesn't know that this service is available. So where it is available, it is very, very affordable. And another way we are making it affordable is including it in the National Hospital Insurance Fund package, so that if you're a member of the fund, then you should be able to access a regular screening as part of the package.
Personally, I have never been screened. First of all, I fear sometimes what you might be told, and then having cancer, it's like a death sentence. So part of it, I would love to be screened, but the fear of being told you have cancer or developing it keeps me away from it. But in future, I hope I will actually go for one of the screens.
Kwa upande yangu sijaenda, but wiki haishi naenda, nihakikishwe kama niko sawa, manake ni vizuri kujijua.
Get vaccinated against hepatitis B and cervical cancer HPV. For women, get your pap smears when they are due. It's not necessarily done every year. It depends on your previous results, but it's usually, on average, every 3-4 years, a pap smear is important. And if you're a woman over 40, then get your mammogram done every year. If you've got somebody in your family with colon cancer, then make sure past 50, you get we call it a colonoscopy, which is a test where they look in through your intestines with a camera to check whether there's any early disease going on. And for men over 45, probably with a family history of prostate cancer or any other risk factor, then you need to get your blood PSA test done so that you can catch these cancers early. So that's just a general package for what people can take home to try and prevent or screen for these cancers. And practice safe sex, because HIV in itself is linked to a lot of many other cancers.
My name is Monica Buluma, an esophageal and stomach cancer survivor. Was diagnosed with the cancer of the esophagus in 2012. Completed all my treatment in October of 2012, and I've been going for regular follow-ups with my surgeons at Kijabe and also with my oncologist at Cancer Care Kenya. And finally this year, after the 5-year battle, this year in April, I was declared cancer-free.
Certainly, as the network of cancer organizations, the different cancer groups that are working in various parts of the country, we do acknowledge that a lot of efforts have been made in terms of allocating or developing infrastructure for cancer around the country. It is not enough. Good effort And a lot of work and money is being put by various counties and national government, but it's not enough. The numbers are far way beyond the capacity that we have at the moment. But a lot of effort have been put in terms of developing or decentralizing cancer treatment. We have cancer treatments now happening in some chemotherapy, at least is happening in some parts like Nyeri, like Mombasa, like Kisumu. They are doing chemotherapy out there. We also have radiotherapy in Eldoret from a private sector player that is giving radiotherapy for patients in North Rift and in those regions. But in terms of public sector infrastructure, Kenyatta National Hospital remains the only place that has radiotherapy equipment. We have a lot of radiotherapy equipment, about 8 machines, Rainy Accelerator in the private sector hands within Nairobi here. But beyond that, we don't have anything in Mombasa, we don't have anything in Kisumu, we don't have anything in other far-flung places, Isiolo and Meru and those places. So we are hoping this is the year that counties and private sector will invest heavily in improving care in those areas.
So currently we do not have enough, but again, through the National Cancer Control Program, we have established a National Oncology Reference Lab. This is, let me call it National Cancer Reference Lab for purposes of the viewers. So this lab is going to be equipped so that it's going to be the referral point for diagnosis. And so currently when it is well equipped, we've already started procuring the equipment for it. So it will be, we'll have a referral system where you have samples being referred from other places and brought to the National Oncology Reference Lab. But then we also have satellite labs that will be set up in several places in the counties where then they can communicate and be able to do the diagnosis. Yeah, and so we hope this is going to improve the diagnostic capacity. So already we have brought the equipment for the oncology lab. So within a few weeks, they should be operational. Yes.
There are also plans to train more cancer professionals, and this will help deal with these rising numbers.
So human resource for health is a challenge across the whole health spectrum, not just specific to cancer. So given that broad umbrella that we don't have enough health workers, so when we come specifically to cancer, which requires specialized care, we do not have enough. But like I mentioned earlier, there are programs that are developing the human resource capacity for cancer. So for example, here in University of Nairobi, we have started a program to train doctors in oncology, and then we have partnerships with other governments like India, Egypt, where our doctors are going for training in cancer. So to answer your question, we don't have enough, but there are plans to increase that. Yes.
The ministry has rolled out plans to do cancer research. This will be instrumental, especially in making cancer vaccines.
We always pride ourselves in doing evidence-based, policy formulation. And so evidence is got from, one of the sources is research. And so what we have done is that we have a research agenda. Within, we have a National Cancer Control Strategy, which we just launched last year, 2017. So it's for the period 2017 to 2022. So within that document, we have a whole pillar on research, and it spells out the research priorities, and they range from prevention to the whole continuum of cancer care. So we have research priorities in there, and so working with the academia, that's the universities and teaching hospitals, then we are engaging with researchers to look at those research priorities, which will then inform how we implement interventions in cancer control, if it's prevention, if it's treatment. So there is a whole pillar that's dealing with research.
So for World Cancer Day, we celebrate many things. The general hashtag for World Cancer Day is We Can, I Can. So it's basically a day where people should come together collectively and divert efforts towards a particular theme for cancer. So for example, in our center here, we have a hashtag called Wearing White, which is basically you wear something white and then you get onto social media and dedicate a message to a loved one that you lost to cancer, because I believe remembering a loved one helps you to accept, it helps you to reflect, and through reflection you can be able to offer patients even better care.
The World Cancer Day is actually celebrated globally on 4th of February. It is a time when the global cancer control community takes to reflect on the achievements that we have had and the milestones around cancer control around the world, but also to look at the challenges and the ways that each one of us can contribute to a more effective and concerted efforts towards controlling cancer in and around the world. And each country takes the time to mobilize stakeholders, usually led by this Cancer Civil Society, in this case, KENCO, but also working closely with the Ministry of Health, the Cancer Control Unit of the Ministry of Health, and other various actors, both state and non-state, who are involved in any way, whether it's in policy, in research, in patient care, in advocacy, in educating the public, everyone doing something about cancer. That's a day to pause and say, where are we with the cancer problem? What are we going to do over the next 12 months? And the World Cancer Day is celebrated under the auspices of the International Union for Cancer Control, UICC. And the UICC gives a theme every year. And for this last 3 or so years, we have had the same theme from 2016. We can, I can, because cancer control is the responsibility of each one of us.
So this year we are joining Kiambu County, and so the event will be held in Kiambu in a school called Kiambu Township Primary. It's within Kiambu town. So on this day, working with the county government, we are going to have awareness campaigns. There will be education where we have specialists coming to talk to the public, a question and answer session where you can come and ask any question and information will be given out. And apart from that, we'll be providing screening services. So we plan to screen for cervical cancer and breast cancer on that day. So members of the public are welcome, and they can come and be screened, come and get information. Yes.
Jitolee, uende hospitali, usiseme hapana, siwezi enda hospitali, mimi naogopa kukufa manini. Enda hospitali, uende uone daktari. Daktari atakuelezea vile utafanya. Usiseme hapana, kansa ni ugonjwa mtu anakufa. Wengine wanakufa na accident lakini bado wewe unabaki. Kwa hivyo ukienda hospitali utapata matibabu na ninajua utapona. Kwa hivyo watu wote wale wako nje, wako wapi, mkubali. Ugonjwa iko na ninajua Mungu ataponya.
Kuna hii issue ya breast cancer. Watu wakisikia breast cancer wanadhani ni historia ya mamanzi. Pia sisi wanaume huwa tunashikwa na hiyo ugonjwa. Na ni vizuri sana kama venye wamama huambiwa, pia hata sisi wanaume tukubali kitu moja. Twende tuangalie breast cancer among other cancer issues that ziko. Ndio at least tukae sawa, tujijue. Prevention is better than cure. Thank you.